one of the things that I'd like to understand better is how benign the process is, right? Because my image as a patient, I go to the hospital, I get put under, I wake up, everything's fine. But how benign is it? Am I the same person when I wake up again? Are there cognitive impairments that can occur, particularly when you're under for a longer period of time? Are you able to sort of shed some light in that area?
What a good question, because certainly everyday activities can cause us to behave differently. Imagine the death of a loved one, a traumatic accident, et cetera, et cetera. Well, surgery is a trauma. How often is one literally cut open? We call surgery, we call the operating room. In the US, we call it the operating room. Elsewhere, I know they call it the OT or the operating theater. We call it controlled chaos because it is everything your body does not want to do, we are forcing your body to do. Your body wants to jump when it's being cut by a knife. It wants instinctively with spinal cord reflexes to grab whatever that threatening object is that is inflicting pain. It wants to stop breathing. It wants to breathe faster. We are fighting your body at every single level, pretty much. Your heart wants to slow down. We have to speed it up. We are literally pushing everything in the opposite direction. That can have a toll, but we have never measured, because once again, we view anesthesia in a very 0 and 1 way, which is appropriate when we're first learning what these medications are. And if we're dealing with life or death, it's a 0 or 1 phenomena. So it's not inappropriate to say the anesthesia was successful or not. But if we ask questions, we'll find very quickly that there are some cases where there are long-term changes. It's most visible in those with the lowest cognitive reserve. Cognitive reserve is like it sounds. How much extra, I guess, how many extra light bulbs do you have upstairs? When individuals have a stroke, for example, depending on the part of the brain where the stroke occurs, they might have cognitive deficits after. Well, there's certain variables that we know confer higher cognitive reserve on a population level. Higher level of educational attainment, for example, the absence of mental health disorders like depression, etc. And there's a long list. And interestingly, they are rather modifiable. Unlike your intelligence or IQ, which appears to be a little bit more ingrained, these are lifestyle modifiable factors, which is very good news, even though we don't talk about this with patients, unfortunately. Cognitive reserve, the less of it you have, like when you are elderly, because there is an age-related decline in cognitive function. In the vast majority of individuals, no matter how hard we try, there is some natural degradation. Those individuals were the first to be observed to have long-term cognitive impairment after surgery, upwards of 20 to 25%, depending on the individual and the type of surgery. So when grandma breaks their hip and has a hip replacement, there is a 1 in 4, 1 in 5 chance that they might not return back to being as bright or sharp or as independently living as they were prior to the surgery. But we don't know if it's because of the anesthesia, because like I said, there are so many other variables going on. Your body is undergoing this incredible trauma from the surgery, which releases so many inflammatory factors that we know affect the brain. You are being given anesthesia, so it could be from the anesthesia, or it maybe could be from the underlying pathology itself or the underlying disease. So for example, if you're coming in with cancer and you need to have the cancer removed, maybe it's the cancer that's contributing to the cognitive impairment that is simply catalyzed by the surgery process. And one of the most interesting levels of evidence we have that the anesthesia actually may not be the main contributor is that when we do surgeries without general anesthesia, meaning we numb the nerves with a spinal, like we put the needle in the back, and we provide anesthesia by simply numbing and giving you just a hair, just a hint of anesthesia so that you're not fully aware of the banging and the knocking and the drilling and all that, because that can be a little disconcerting. Those cases seem to have similar rates of cognitive impairment, meaning that the general anesthesia appears to be not a variable or a predictive variable at all. You can numb an arm and they still have the same risk, for example, even if you're not fully asleep. So we don't know why, but we know that cognitive reserve appears to correlate. And that's very good news for us because once again, we can affect our cognitive reserve at any stage in life. But this is very preliminary, very, very,
Mm.
very preliminary about how much, because we don't have a good way of measuring cognitive reserve at all. So how do we predict? We know that if a patient wakes up delirious after surgery, meaning
Hmm.
that for a prolonged period of time, their light bulbs are just haywire. They're Imagine like one of these horror movies where different lights are turning on at different times, kind of stochastically, and there's no pattern. It's just like nothing is coordinated. That happens in individuals that we believe are susceptible to cognitive decline, and they might spend more than just 1 or 2 minutes after waking up being disoriented. They might be disoriented for days at a
Hmm.
time. And those are one of the predictors for them not being fully with it after they recovered from that delirium as well.